Imagine for a second, right, that you break your arm.
Okay, definitely not a fun stew, but I'm with you.
No, yeah. So you walk into an emergency room and you're cradling this clearly broken bone.
Oh, yeah.
You walk up to the front desk and the receptionist looks at you, types a few things into her computer, and is just like, well, unfortunately, setting a bone is considered an optional luxury upgrade under your plan.
Wow.
Yeah. She says, so, we don't cover that, but we can offer you a discount on a sling.
That is just, I mean, you would completely lose your mind.
You would. You'd think the entire system was completely insane.
Absolutely.
But here is the wild part. For decades, that is exactly how health insurance treated your brain.
It's true. It sounds totally absurd when you frame it like that, but it's entirely accurate.
Right.
The brain was treated as this, like, secondary, almost cosmetic aspect of human health.
Right. And while the laws have changed, the hangover from that era is still incredibly strong.
Oh, definitely.
Like, when I talk to people about starting therapy, the number one reason they stop isn't the stigma anymore.
Yeah, that's shifted a lot.
It has. And it isn't a lack of desire either.
No, people want the help.
Exactly. It is the exact moment they have to look at their health insurance coverage.
Just instant dread.
Yes.
Yeah.
You're sitting there staring at a screen full of, like, acronyms and deductibles and fine print.
And the administrative dread just completely washes over you.
It feels like this giant wall you can't climb.
And that confusion isn't just a minor annoyance for people. It is an active, practical deterrent to getting care.
Totally. So today, our mission on this deep dive is to tear that wall down.
I love that. Let's do it.
We are going to look under the hood of how mental health insurance actually works, specifically focusing on Georgia today.
Which is super important context.
Yeah. And our insights today come from a really comprehensive, plain language guide provided by a Georgia-based practice called Coping and Healing Counseling.
They're also known as mental space therapy.
Right. Yes, exactly. They put together this breakdown of the whole system. So by the end of this conversation, you, the listener, will understand the exact mechanics of mental health coverage.
So you could actually make a decision without that paralysis of information overload.
Right. Because does my insurance cover therapy is the single most common question practices here.
And it is entirely possible to demystify this. I mean, the system has rules, and once you understand the rules, the anxiety around it drops significantly.
So let's start with the most fundamental question, right? Does your insurance even cover therapy?
The short answer is an enthusiastic yes.
Which is great, but I don't just want to say yes and move on. I want to understand why it's yes today, because like we just talked about with that broken arm analogy, historically it really wasn't.
No, historically it was incredibly bleak.
How bad are we talking?
Well, insurance companies viewed mental health as this high-risk, optional category, so they would impose massive restrictions.
Like what kind of restrictions?
You might get a lifetime maximum of, say, 20 therapy visits ever.
Wait, ever? In your whole life?
In your whole life. Or they would charge you a 50% copay for a psychologist, while a visit to a physical specialist only cost you, like, a flat $20 copay.
Oh, wow. So they were actively discouraging you from using the benefit.
Exactly.
So what changed the game? Why are we confidently saying it's covered now?
The fundamental shift came from a piece of federal legislation called the Mental Health Parity and Addiction Equity Act.
Okay, let's unpack this.
Yeah.
What does parity actually mean in the context of an insurance company?
Parity simply means equal treatment. If we connect this to the bigger picture, this law essentially mandates that most health plans must cover mental health services at the exact same level that they cover medical and surgical services.
Okay, so equal treatment across the board.
Right. The mechanism here is actually quite elegant in its strictness.
Oh, so?
Well, let's say your insurance plan allows unlimited visits to an endocrinologist for a chronic physical condition, like diabetes. Because of the Parity Act, that insurance company is legally forced to allow unlimited visits to a therapist for a chronic mental health condition, like major depression.
Okay, I see. So they can't treat the brain differently than the pancreas.
Exactly. They cannot apply stricter financial requirements, like higher copays, to your mental health.
Or stricter treatment limitations, like those visit caps you mentioned earlier.
Right, they have to treat them equally.
But wait, I have to push back here for a second.
Go for it.
Because if this federal law exists and it's so strict, why do so many people listening to this right now still feel like their claims get denied?
That is a very fair point.
Or why is it still so hard to find someone who takes their insurance? Like, if parity is real, is there some massive loophole the insurance companies are exploiting?
That is the crucial question. It's not so much a legal loophole as it is a difference between the existence of a benefit and the friction of accessing it.
What do you mean by friction?
Well, an insurance company can't deny the category of mental health care anymore, but they can still require complicated prior authorizations.
Oh, the paperwork?
Right. Or they can maintain very narrow networks of therapists who are actually contracted with them.
So the coverage is legally mandated to be there, but the maze to get to it is still designed to be complex.
Exactly. Which brings us right back to why understanding the mechanics of your specific plan is so vital.
Okay, so the Parity Act forces the hand of private insurance companies on a federal level. But how does that translate when we look at state-funded plans?
It's an important distinction.
Because when we talk about Medicaid, state budgets are notoriously tight. Does parity apply when the state taxpayers are footing the bill?
It absolutely does, and the way Georgia handles this is actually quite robust.
Okay, I'm listening.
To understand how Medicaid pays for therapy, you have to understand the mechanism of managed care. Georgia uses something called Managed Care Organizations, or CMOs.
I see that acronym everywhere when looking at state health stuff. CMO. What exactly is a managed care organization? Explain this to me like I'm 5.
Okay, think of Medicaid as a giant pool of state funding.
Right.
The state government wants to provide health care to eligible residents, but they do not want to be in the business of processing millions of individual therapy claims.
Or running call centers, I'd imagine.
Exactly, or building networks of doctors. So they hire private companies, these CMOs, to manage the care for them.
Ah, okay.
The state gives the CMO a set amount of money per person, and the CMO handles the actual logistics of getting that person care.
Okay, so they essentially outsource the administrative headache.
Precisely. In Georgia, there are 3 specific CMOs that handle Medicaid: CareSource, AmeriGroup, and Peach State Health Plan.
And coping and healing counseling takes those.
Yes, they are in network with all 3 of them.
But let me ask the cynical question here.
Let's hear it.
I'm looking at the notes from the source, and the out-of-pocket cost for therapy under these Georgia Medicaid plans is exactly $0.
Yep, 0.
Nothing. That sounds way too good to be true. Usually, there is this pervasive idea that state-funded Medicaid only covers mental health if you are actively in a severe, like, life-threatening psychiatric crisis.
Like you have to be at rock bottom.
Exactly. Like, you only get a $0 visit if it's an absolute emergency.
That is one of the most persistent and genuinely damaging misconceptions out there.
Really? So it's not true?
It is fundamentally untrue. People assume Medicaid is only a final safety net for emergencies. But Georgia Medicaid covers a tremendously wide spectrum of mental health care.
Like what else?
We're talking about ongoing, consistent individual therapy. They cover family therapy, couples therapy, group therapy, and full telehealth access anywhere in the state.
Wait, really? They cover ongoing couples therapy for $0?
Yes. It is not just a one-off visit to put out a fire and stabilize you. It is continuous preventative care.
That's amazing.
And if you think about the underlying logic of managed care, it makes absolute financial sense for the state.
How so? Because paying for weekly therapy sounds expensive.
Providing consistent weekly therapy is vastly cheaper than paying for inpatient hospitalizations or emergency room visits.
Oh, or the fallout of a family in severe crisis.
Exactly. Keeping a person mentally stable saves the state money in the long run.
That makes so much sense. So if you are listening to this and you have Georgia Medicaid and you've been putting off finding a therapist because you assumed you'd get hit with a bill you couldn't afford,
That financial barrier is just an illusion.
it truly is $0.
It is a profound resource that goes heavily underutilized because of that exact misconception.
All right, so Medicaid is surprisingly straightforward because the state is subsidizing the cost down to $0.
Right?
But let's look at the other side of the coin. What happens when we leave the state safety net and jump into private commercial risk pools?
Ah, the commercial landscape.
Yeah, the employer-sponsored plans or the plans you buy on the healthcare marketplace. This is where the vocabulary gets really aggressive.
It is a completely different machine, and this is where people tend to get paralyzed by the jargon. We're looking at major players here. The practice we're referencing accepts Humana, Aetna, Cigna, United Healthcare, which you might also see listed as Optum Blue Cross Blue Shield, and Anthem.
That covers a massive portion of the corporate workforce in the state.
It really does.
But unlike Medicaid, this isn't free.
No, not at all. Commercial insurance relies on a shared cost model.
Okay.
And this is where we run into the three terms that cause the most dread: deductible, copay, and out-of-pocket maximum.
Okay, we need to break these down because I think people hear the word deductible and their brain just shuts off.
It's very common.
What is the actual literal mechanism of a deductible versus a copay?
Let's walk through it chronologically.
Yeah.
A deductible is the financial hurdle you have to clear entirely on your own before your insurance really steps in to help.
Okay, give me an example.
Let's say your plan has a $1,000 deductible. That means you are paying the full contracted rate for your therapy sessions. Let's say it's $100 a session until you have spent $1,000 out of your own pocket for that year.
Okay, so I have to buy 10 sessions at full price before my insurance company even starts paying their share.
Exactly. You are carrying the weight up front. But once you clear that $1,000 hurdle, you drop into the copay phase.
And a copay is better, right?
Yes, a copay is a flat shared fee. Now, instead of paying $100, you only pay a $20 copay per session, and the insurance company covers the remaining $80.
Okay, that actually makes sense. And what about the out-of-pocket maximum?
That is your worst-case scenario safety net.
Like if I have a terrible year medically.
Exactly. You need knee surgery, you have lots of therapy, you have expensive prescriptions. Once your total spending, your deductible, plus all those $20 copays, hits a certain maximum number set by your plan, the insurance company steps in.
And they pay for everything.
They pay 100% of everything else for the rest of the year. Your copays drop to zero.
So it caps your financial ruin.
Exactly.
But all of those numbers, the $100 rate, the $20 copay, they all hinge on one very specific phrase: in-network.
Yes, that is the magic phrase.
Let me try an analogy here to see if I understand the mechanics of this.
Let's hear it.
Being in-network isn't just about the insurance company liking a certain doctor, right? It's essentially a volume discount.
Okay, I like where this is going.
Let's say being in-network is like an insurance company having a VIP club membership at a chain restaurant.
Okay.
The insurance company goes to the therapist and says, look, we have thousands of members in your area. We will send you a ton of patients, basically guaranteeing your schedule stays full.
Right.
But in exchange for that volume, you have to agree to charge them a pre-negotiated flat menu price.
That is a highly accurate way to look at it. It is a binding contract based on bulk access.
Okay, so it's a trade-off.
Yes. The therapist trades the ability to charge a higher possession rate for guaranteed patient volume and the marketing of being listed in the insurance directory.
And out-of-network, on the other hand, is like wandering into a luxury restaurant where there are no prices on the menu at all. The therapist hasn't signed any contract with your insurance. They can charge literally whatever they want, say $250 a session.
Right, because there's no agreement.
And your insurance company will look at that bill and say, well, we only think a session is worth $100 and we're not paying the difference. That's on you.
Precisely, which is a practice known as balance billing.
Balance billing, okay.
When you choose a provider who is in-network, like coping and healing counseling is with those major plans, you are shielded from balance billing.
So no surprise fees.
Right. You are legally protected by that VIP menu pricing contract. It guarantees you are getting the absolute lowest possible cost that your specific plan allows.
Knowing the price before you order is huge, but that brings up the next massive hurdle.
The dreaded phone call.
Yes. Knowing you have an in-network plan is great in theory. But the actual dread of having to sit on hold with an insurance company?
Listening to that terrible elevator music.
Trying to get a straight answer out of a customer service rep reading from a script. That is enough to make anyone procrastinate.
Oh, 100%.
How do we bypass that headache? Because I'll be honest, the dread of that phone call is why I would put off finding a therapist for months.
That administrative friction is exactly what causes so many people to drop out of the process. And frankly, insurance companies don't exactly have a strong financial incentive to make that process quick or painless.
Yeah, if it's hard, people just give up.
The friction itself acts as a deterrent to you utilizing your benefits.
It's a feature, not a bug. If they make it hard to use, they save money.
Exactly. Which is why the gold standard in the mental health industry right now is for the practice to remove that burden from you entirely.
Do they actually do that?
Yeah, the Coping and Healing Counseling Guide outlines a brilliantly frictionless 4-step method they use, which is a perfect example of what you should look for in any provider.
Okay, walk me through how they do it.
Step 1. You simply request an appointment on their website at chasetherapy.com.
Easy enough.
Step 2. The CHC administrative team takes over completely. They're the ones who call your insurance company.
Oh, wow.
Yeah, they speak the jargon, they know what questions to ask to verify your exact benefits, and they sit on hold so you don't have to.
That is incredible.
Then step 3, they come back to you and tell you exactly what your copay will be before you ever attend the first session.
So no surprises.
And step 4, you attend your session with absolutely zero financial guesswork.
Here's where it gets really interesting. This completely shifts the structural burden.
It really does.
You don't have to navigate phone trees. You don't have to pretend you know what a deductible is while talking to a rep.
Just show up.
If a practice can remove that uncertainty up front, it allows you to focus entirely on whether you are emotionally ready for the hard work of therapy rather than the anxiety of paying for it.
It is a structural solution to a psychological barrier.
Okay, but we have built a very neat, tidy box here of covered plans, in-network contracts, and smooth administrative processes.
Right, but not everyone fits in that box.
Exactly. What happens to the person listening right now who realizes they fall completely outside of that box? What are the safety nets for people who are uninsured or whose specific plan wasn't on that list?
There are always alternatives, but you have to know what to ask for. If you are entirely uninsured, the immediate next step is to ask a practice if they offer sliding scale fees.
How does a sliding scale actually work in practice?
It's an equity-based pricing model. Instead of a flat rate for everyone, the fee is adjusted based on your gross income and your household size.
So it scales to what you can afford.
Exactly. The less money you make, the less you pay per session. It's a way for practices to serve the broader community while still keeping their doors open.
And what if they don't have any spots left?
Even if a specific clinic doesn't have open sliding scale slots at that moment, they often have robust referral networks of clinics that do.
That's good to know. And what if I do have insurance, but my plan is just some obscure one that isn't listed as in-network?
Call the administrative team anyway, even if they are out of network, meaning they don't have that VIP volume discount contract. They can still help you.
How so?
Sometimes your insurance has out-of-network benefits that will reimburse you for a large percentage of the cost after the fact. A good administrative team will explain your options and won't just leave you in the dark to figure it out alone.
There is another really crucial detail here that acts as a massive safety net, and it's something a lot of people in Georgia don't realize has changed.
Yes, the Pathways to Coverage program.
We need to talk about this. So many people just assume they don't qualify for Medicaid.
It's a huge blind spot.
They think, oh, I have a job, I make a little too much money, I don't have kids. They just assume they are disqualified.
Right.
But Georgia recently expanded its eligibility pathways. The parameters have shifted significantly.
They have. Many people who were previously in the coverage gap now qualify.
And checking to see if you qualify under the new rules takes literally 10 minutes at gateway.ga.gov. 10 minutes. You might be walking around uninsured right now, stressing about out-of-pocket costs, completely unaware that you legally qualify for that $0 care we talked about earlier. Spending 10 minutes on that website could permanently change your access to health care.
It is one of the highest yield actions you can take for your health and your finances.
Totally agree. So I want to take a breath here. We have spent this entire deep dive talking about the upfront literal cost of going to therapy.
Deductibles, copays, out-of-pocket maximum.
Yeah, all of that. But to truly understand the value of this, we have to flip the equation completely.
We really do.
We sit here and fret over a $20 or $40 copay, treating it like an extra expense, like a streaming service we might not use. But what is the actual financial anatomy of ignoring a mental health issue?
What's fascinating here is where the conversation has to shift. We have to look at the cost of not going.
Right.
Because the hidden costs of untreated mental health are staggering, and they compound over time.
Give me an example.
When you ignore mental health, it doesn't stay neatly confined to your thoughts. It manifests physically, and it manifests financially.
Let's break that down with a real-world example from the text. Because panic attacks are incredibly common, and the financial fallout of one is a perfect case study.
It is the starkest example we have. A severe panic attack physically mimics a heart attack.
Which is terrifying.
It is. You experience crushing chest pain, shortness of breath, a racing heart, dizziness. If you have never had one before, your immediate logical survival response is to call an ambulance or go straight to the emergency room.
And let's look at the literal bill for that. An ambulance ride can easily run you $1,000 right out of the gate.
Oh, easily.
Then you have the ER intake fee. They have to run an EKG to check your heart. They run blood panels. You take up a bed for several hours.
It adds up so fast.
You were looking at a medical bill of $3, $4, maybe $5,000. And at the end of all that, the doctor comes in and says, your heart is fine. It was severe anxiety.
And that $5,000 bill is just the immediate medical cost. What about the secondary costs?
Right.
Severe depression and anxiety often lead to missed work days. They lead to stalled career progression or even job loss because you simply cannot function.
Then there's the relationship toll, the absolute financial and emotional devastation of a divorce fueled by untreated trauma or an inability to communicate.
The massive.
Or think about the steep cost of substance use. The thousands of dollars spent on alcohol or drugs over years and years as a way to self-medicate because the emotional pain is just too loud.
When you lay all of those outcomes out on the table, the math shifts entirely.
It's night and day. We were talking about dodging a $5,000 ER bill or a $15,000 divorce lawyer by paying a $20 copay.
Exactly.
When you reframe it like that, therapy isn't an expense at all. It is the most aggressive form of preventative investment you can make. It is routine maintenance.
It really is.
You don't ignore a grinding sound in your car's engine because you want to save $50 today, only to have the entire transmission explode on the highway next month.
It is the exact same principle. The copay is just the cost of routine maintenance for your life.
That makes perfect sense.
Yeah.
So let's bring this all together for you listening right now. The ultimate takeaway from our discussion today is this. Insurance shouldn't be, and does not have to be, the wall between you and feeling better.
It is a messy system, yes, but the laws are actually on your side.
And there are practices actively working to navigate the maze for you.
The logistics are entirely manageable when you understand how the machinery works.
So if you're in Georgia, let me give you the roadmap provided by our source today, Coping and Healing Counseling, also known as mental space therapy.
Yeah, check them out.
You can visit chashetherapy.com to request an appointment. Let their team do the heavy lifting. They will verify your insurance and tell you your exact out-of-pocket costs before you ever sit down for a session.
Which removes all that dread.
Exactly. They offer telehealth anywhere in the state. And if you want to reach out directly to ask questions, you can call them at 404-832-0102 or shoot them an email at support@shelaptherapy.com.
You know, I want to leave you with one final thought to mull over today.
Let's hear it.
We just broke down the massive personal costs of avoiding therapy. You know, the ER bills, the lost jobs, the divorce. But think for a moment about the invisible ripple effect of untreated mental health.
The ripple effect.
Yes. If untreated trauma, anxiety, or depression damages relationships and destabilizes family dynamics over years and years, what is the profound generational impact of just one person deciding to brave the insurance confusion today?
Wow.
By taking that step, you aren't just healing yourself. How might your $20 copay today fundamentally change the emotional landscape for your children or your grandchildren decades from now?
That's powerful.
When you break down that wall of confusion for yourself, you are clearing the path for everyone who comes after you.